Welcome, everybody, to another episode of Living with FASD Candid Conversations with Patty Casper. This week on this Educational and Human Interest show, I am bringing back to the mic Dr. Jerrod Brown, who is gracing us not just with the once every 6 weeks topic, but actually this is going to have a bonus episode. We're going to show you 2 episodes in the same week because it's such a huge topic, and one that everyone's going to be able to relate to, whether or not they have FASD, whether or not they're neurodivergent or neurotypical. It's not going to matter because, drum roll, sleep bothers all of us. We all have issues from time to time. But without further ado, I'm going to let Jerrod take it away and talk about why sleep is such a big issue for those of us with fetal alcohol spectrum disorder. Jerrod, my friend, thank you so much for coming back on Living with FASD.
Thank you, Patty. Thanks for having me back, and hope all of you are doing well. So we're going to talk about sleep today, and just to kind of give all of you a background on why this topic's important to me. I'm a certified sleep health coach. I have extensive training and education in sleep and all kinds of facets. I give numerous trainings on the topic of sleep from all kinds of angles. I've given talks on sleep and bowling, sleep and homelessness, sleep and autism, sleep and FASD, how sleep contributes to suggestibility and false confessions. I mean, the list goes on and on. Sleep is important, obviously.
Yeah. What was that first one?
Sleep and bowling. Yeah, like bowling. Children who get bowling, like bowling.
Oh, bullying.
Like, yeah,
I'm
bullying,
thinking is this a, you can't get a strike or a spare?
That's a great.
You said bowling, and I'm like,
That'd be an interesting talk. Hey, that might be a follow-up for us. It could improve your bowling game with good sleep. I'm
right. Sleep would
I'm confident on that one. So
sleep would not help my game. Guaranteed. Once again, the ball goes that way. Just like sports, nobody wants me on their team.
Well, sports, great segue. There's research on if you want to enhance athletic performance, get better sleep. Yeah. Sleep is number one to health over anything, in my opinion. I think that's pretty safe to say, because if you don't sleep, you can about imagine how much you function. So good sleep is related to better thinking. Mm-hmm. It reduces inflammation in our body. And
really?
Yeah, when we remember that talk we did on psychoneuroimmunology.
Yeah.
The interconnectedness between like our thinking and our inflammation and our gut and our hormones. If you want to calm down chronic low-grade inflammation in your body, get good sleep.
Okay.
So if you want to drive, if you want to exacerbate it, chronic sleep issues makes it worse and worse and worse.
Okay, so is the mechanism for that, is it because it's during sleep that you have a lot of those hormonal dumps from all your endocrine system, and without those dumps, you just kind of you have the inflammation?
Well, our body's like an engine. You need to turn it off and slow her down. And when we sleep, lots of things go on at the biochemical level. And one thing that happens, there's actually a neural plumbing system in our brain that they've done several studies on this, that chronic sleep issues over a long haul builds up toxins in our body. And there are some studies on chronic sleep issues and neurodegenerative disorders, speeding that up over decades. So when we're getting deep sleep, that's a detoxification process for us, amongst all kinds of other things.
What about sleep and cancer? Are those related?
Lots and lots of research on sleep and cancer. In a couple directions. Cancer can drive the bus with sleep issues because of worry and fear, and also the pain around cancer. And again, if we're not sleeping well, our bodies are typically not working at optimal levels. Yeah. So it might contribute to more oxidative stress and hormonal dysfunction and gut issues. And over the long haul,
Yeah.
that
I
can create
asked,
more disease.
yeah, I asked that question on behalf of all the caretakers, right? Because when we are caring for someone, no matter what the cause, right, or no matter why the need, we tend to get sleep deprived. Whether it's parents of littles with fetal alcohol, or in the case of a good friend of mine, who was also caregiving for her parents, just like I am, um, years of sleep deprivation, and now she's battling the big C.
Yeah, I can't
Yeah.
say
And
it's
she's in her
100% connection.
40s.
Yeah, I mean, it sure makes everything worse.
Yeah.
Chronic sleep issues are a risk factor for child abuse, domestic
Hmm.
violence,
Yeah.
burnout. It's a stress magnifier. One of the frontline interventions for trauma treatment, if you're ever working with folks with extensive trauma, is get their sleep better.
Hmm. Yeah.
Mental health
Well,
is
and
improved by better
addictions
sleep.
too.
Huge.
I first learned about HALT when I was doing substance abuse work back, 30 years ago, when I was a new graduate. I think around 1989. Yeah, 88, 89. So long time. No, don't let yourself get too hungry, angry, lonely, and tired, right? Because then you can relapse. But I also find that that's equally true as a caregiver
Yeah.
with my mom. If I'm hungry, angry, lonely, or tired, or just had a real crappy day at work, um, I'm much more. I have a shorter fuse.
Without a doubt. Yeah.
Yeah,
I mean, it relates
yeah.
to impulse control. It has an influence on our eating habits. There's plenty of
Mm,
research on sleep issues and
yeah,
social skill deficits. So, I mean,
yeah,
anything you can imagine, it's linked to that. Almost
yeah.
every mental health disorder, sleep issues are
Wow.
right there. Most medical health issues,
Why
sleep
don't they
issues.
teach us this in grad school? They
I
should.
don't I don't know. There are certifications out there. There are classes offered in this. Like in my
Hmm.
doctorate degree, I did take a sleep class,
Hmm.
but it was an elective, so
Yeah,
it's not a frontline thing, and I wish it was because
yeah.
sleep issues are so
Universal.
in the general population.
Yeah,
But think about this. They're very common in general. COVID made it worse.
yeah.
There's actually a sleep disorder that if you follow the COVID literature, is called COVID insomnia, which is basically insomnia on steroids. And if you Google
Oh,
COVID insomnia, they talked about this being very prevalent during like the lockdowns, the stress, the worry, and all that. So
yeah,
it's circadian rhythm misalignment
yeah.
and
Yeah.
all of that stuff. So sleep, very important to health. Number one, there's
And I
all
can see that going a couple different ways, right? The COVID insomnia. One is because you're up glued to the TV looking for news, looking for updates, looking for how bad it's gotten, right? Because the news cycles are very addictive.
yeah,
Or the other way around, there's nothing else to do. You might as well sleep. And then all of a sudden, you can't sleep anymore.
yeah.
Yeah.
Oversleeping is very, very bad, and undersleeping
Mhm.
is bad. And I'm not talking like what you miss a night of sleep here and there. I'm
Yeah.
talking about more chronic, long-term kinds of things, but
Yeah.
there's all kinds of sleep disorders,
Oh,
insomnia being
mhm.
the most primary one. But
Yeah.
interestingly, people are surprised to learn how many subtypes of insomnia there are. I can't even count how many. There's primary insomnia, secondary, acute,
Mhm.
and chronic, and adjustment insomnia. There's all kinds of little subtypes of insomnia.
And COVID insomnia.
Of insomnia,
Yeah.
absolutely. So
Yeah.
very, very common. And just insomnia in general, the symptoms that go along with it, higher anxiety,
Mhm.
memory problems,
Mm.
increases irritability, depression, all kinds of things.
Yeah, I
And
can
the
I can
risks,
tick all those boxes and see how that's
yeah,
played out at different points in my life.
absolutely.
Yeah.
And
Yeah.
we've all had sleep issues probably from
Hmm.
time to time.
Yeah, I
The
think it's a
risks,
universal.
Absolutely. The risk factors for this are all over the map, and this is more in general, not FASD yet. Being female has been linked to having more insomnia.
Really?
Yep. Could be some hormonal factors to take
Okay.
into account there.
Yeah.
The research talks about. The aging process has been linked with more insomnia, especially people over the age of
Mhm.
60, the research says. Obviously, looking at what's going on in your life,
Mhm.
stress, what we eat,
Mhm.
who we hang
Yeah.
out with. Are we dealing with pain issues? Are we one to be on the screen all night long?
Yeah.
Certain medications. So the list goes on and on and
Yeah.
on, all over the map.
Yeah, and I think what you said a few moments ago too, the opposite is also an issue, right? The hypersomnia. I know from time to time I bring my mom up into it, right? Because she has another neurobehavioral condition, right? Lewy body dementia. She sleeps. She's been with me for almost just under 4 years. And this entire 4 years, she sleeps at least 18 hours a day.
Yeah. Okay.
If she can stay up and play cards most of like on Saturdays, that's just what we do, then she pays for it over 3 days and she'll only be awake, 3 or 4 hours out of
So hard.
24. And I haven't really worried about it because to me, sleep is the best narcotic. If you're in any kind of pain, you're not aware of it while you're sleeping. But to hear you say that, maybe I should worry.
Well, I guess everyone's individualized, but based
Yeah,
on the surface, someone sleeping that many hours, it's probably not a good thing. Talk to your doctor. I don't want to give
yeah,
medical advice here, but living a
yeah.
sedentary lifestyle drives up the bus on
Mhm,
inflammation. If you look at the research on oversleeping in general, just take out any disorder, oversleeping could be a potential sign of disordered sleep. So if someone
mhm.
sleeps a long period of time, that's a factor. Rule out
Yeah,
depression, it
yeah.
talks about. Rule out hormonal imbalances, nutritional imbalances,
Mhm.
and also being aware how oversleeping can exacerbate cognitive problems. So more
Yeah,
executive function impairments,
yeah,
more concentration issues, and it could be a factor in obesity and diabetes and body pain and headaches, just to
yeah,
name a few.
yeah. So then it's figuring out what's the Louis and what's the oversleeping when it comes to cognitive
Yeah,
function. Yeah.
probably
Hmm.
probably both work hand
Yeah,
in hand, unfortunately. And
yeah.
so
So
when we
we've talked about a couple things, right? Difficulty falling asleep, right, from the stress and everything else going on, and difficulty staying asleep. Those are certainly two aspects of insomnia.
you know,
Um, or the sleeping too much. All three of those are classic primary characteristics of FASD.
but yeah,
Yeah.
absolutely. Definitely, and I'll give you a lot of things to think about when we think specifically FASD and sleep. But just taking FASD out of the equation, sleep deprived people might be more likely to say inappropriate comments or make more irrational social decisions and take greater risk.
Mm,
And that all sounds like FASD without sleep.
yeah. Yeah. Yeah, it does. Yeah.
We have a tendency to maybe be more self-critical,
Hmm.
and rumination can be exacerbated when we are chronically sleep deprived.
Hmm.
And sleep impacts everyone throughout the lifespan too. So there's pediatric sleep issues, there's sleep issues in children. And one thing I'll say
Hmm.
about if you're ever working with kids who have a lot of disruptive behavioral patterns,
Hmm.
the child goes to school and looks a lot like having ADHD. The research says before diagnosing and jumping to the conclusion that they may have ODD or conduct disorder or
Yeah.
ADHD or whatever it is, has anyone ruled out the
The
possibility
sleep.
of chronic sleep issues,
Yeah.
but also sleep disordered breathing, where there's a link between snoring and maybe more
Mm,
behavioral problems? And they say treat the snoring, and it may
interesting.
make those things get better. Not
Okay.
saying it'll cure it, but and if you have trauma too, it always says rule out trauma, rule
Yeah.
out sleep. So
Yeah. And certainly I've seen a lot with my caseloads through the years, where, the precious kidlets on my caseload have learned that they have to sleep with one eye open, so to speak, in order to stay safe. And even though once they're in care, they're in a physically safe environment, that felt safety maintains those patterns of very light, uh, non-restful sleep.
absolutely. And I'll send you a link when I do it, but I'm putting together an actual training right now for a different group on sleep disturbances among children in the foster care arena.
Oh, wow. Okay.
There's a lot of research on that topic. It's a
Yeah.
really fascinating and important topic that foster care parents and adoptive parents and even child protection specialists a lot of times I don't think get trained on or think about,
Hmm.
and how that is another layer
Hmm.
to the complexity of these kids really feeling safe and secure
Yeah.
wherever they're placed. So
Yeah.
I'll send you some info on that when that comes
Thank
out.
you. I'd very much appreciate that. And I know my coworkers would be happy to get that as well.
Absolutely.
Yeah.
Now, as I say, if once I segue into FASD, so depending on the research you look at, there 20 plus articles on FASD and sleep, maybe
Hmm.
25, somewhere in there. Not a lot, but the research says 80 to 85% of people with FASD have sleep problems. And it's not just insomnia. We're
Oh.
talking all kinds of other sleep issues. That number is astronomically higher than like kids in the general population.
Hmm.
And if that person with FASD also has a co-occurring disorder, which everyone with FASD typically has a co-occurring disorder,
Or several.
depression, anxiety, yeah, AD, whatever it
Yeah.
is, that number goes up and up and up. So if you were to
Okay.
go through all the articles on FASD and summarize it, what are the causes that are talked about in the research for FASD and sleep? It talks about irregular sleep schedules as being a factor. So if that child or teenager or adult is going to bed this time this night, a different time the next night, the weekends they're up later, the irregular sleep schedule,
Hmm.
huge, absolutely. Having a lack of structure around bedtime routines where it just
Hmm.
drags on for hours and stress,
Yeah.
not good. It does talk about self-regulation and self-control issues being a factor. Memory problems is actually talked about as possibly being a factor with contributing to more sleep problems among people with FASD. It
So
also
the
talks,
memory issues are causative towards sleep issues?
part of it is maybe they've learned an intervention about getting better sleep and they forgot.
Okay.
They forgot they took a long nap earlier, so now they're going to take another nap and they throw out their sleep cycle.
I'm sorry.
They
That
for
sounds like my mother.
Yeah, they forgot that they ate dinner and now they just ate a ton of food right before bedtime and it throws off their hormones and blood sugar. So there's a lot of
Yeah.
reasons for that,
Yeah.
but a memory is a factor. And hormonal imbalance is very common in folks with FASD because we know that prenatal alcohol exposure can damage the HPA axis, the
Hmm.
hypothalamus pituitary adrenal axis, which is a hormone regulator.
Yeah.
And it's that inability it talks about too to self-soothe
Hmm.
and not be distracted by stimuli. So bright lights,
Hmm.
fabric, the tag on a clothes, pajamas, all of
Yeah.
these things are talked about in this research literature. So those are some of the causes. Interestingly, too, there is some research that talks about prenatal alcohol exposure and nicotine exposure, which go hand in hand in a lot of
Hmm.
cases. Not all, but a lot, cause sleep in and of themselves. And part of the reason why is that prenatal alcohol and prenatal nicotine exposure can actually have very bad adverse outcomes on that child's arousal system
Okay.
and respiratory functioning. So we have an arousal issue in the central nervous system
Mm-hmm.
where they get overwhelmed quickly and
Yeah.
maybe they can't calm down. And then maybe there's some breathing problems too that might be caused by the prenatal exposure to alcohol. And there's some breathing difficulties. So another tip would be work with a breathing specialist, maybe if you're
Yeah.
noticing some unusual things like that.
So are we talking about sleep apnea?
Sleep apnea has been noted to be elevated in this population as well.
Mm-hmm.
And there's multiple types of sleep apnea. Well, there's a few types. There's obstructive sleep apnea. So maybe it's someone that broke their nose or something, or there's some
Mm-hmm.
breathing problems, or they sucked their thumb a lot as a kid, and now the bridge of their mouth is closed in and they're not getting a lot of air. But sleep apnea can also be caused by structural damage to the brain, central sleep apnea, where the circuitry in the brain is not
Mm-hmm.
communicating properly. So definitely work with a sleep specialist to
Okay.
rule out if that is an issue in some cases. So it's
Mm-hmm.
definitely something to think
Mm-hmm.
about. If you were ever, if you, Patty, if you've ever worked with someone with arousal issues, which I'm sure you have a million
Mm-hmm.
times over, think of hyperarousal issues, that fight or flight response,
Yeah.
where if someone with FASD has also had a trauma history or they're dealing with a number of these comorbidities,
Yeah.
they might become more irritable quickly, they might
Yeah.
become more angry. All of that, just all that energy goes in their body. It can throw out their hormones. And if that
Mm-hmm.
happens right before bedtime, good luck
Yeah.
falling asleep.
Yeah.
So
Yeah.
you have that physiological reactivity, heart rate starts racing, your breathing
Mm-hmm.
picks up. The
Yeah.
same can, if you want to know what that feels like, watch a really tough, scary, violent movie right before bedtime. And I bet when you turn off that movie, you're going to feel amped up,
Yeah.
might feel
Yeah.
heated. That's
Yeah.
physiological dysregulation that's going on in our bodies.
Yeah. Yeah. I don't mind going to sleep if it's on like HGTV. Or the most stressful thing is what's the house going to look like when they're done? Um, but any kind of show with a plot or suspense, I won't do it. I'd rather stay in my office and get work done, than go to sleep with that coming into my senses.
In an ideal world, and we'll talk about this in the strategies part two, getting off the screen and the gadgets when
Mm-hmm.
the sun starts going down outside
Yeah,
is recommended. How many people
yeah,
do that? Not that many.
right.
So that
Very
might be
few.
getting off your screen 2 hours before bedtime.
Mm-hmm. Yeah,
Very hard
and
for a lot of people.
well, and the reality though is that if you're living in a partnership with somebody, you both have to be in agreement on those things.
Absolutely.
Um, and and someone who is used to having the ambient light or the background noise, um, being with someone who prefers dark and silent, um, there's give and take there.
It's tricky. And I'll give a lot of sleep hygiene tips and strategies part two.
Mm-hmm. Yeah, so for
FASD,
for the listeners and the viewers watching this part one episode, we're dealing with history, causes, yada yada yada, and links with fetal alcohol. Part two, which is the bonus episode, is all about interventions. So today's a teaser. And with that
we
note, keep
sure hope
going,
so.
Jerrod.
Prenatal alcohol exposure has been linked with causing more disruptions in the sleep-wake cycle. So when you study the sleep-wake cycle, very important to understand our circadian rhythms.
Mhm.
And part of COVID insomnia that we talked about briefly before is disruptions in the normal sleep-wake cycle where maybe people were staying up later at night,
Mhm.
glued to the TV,
Yeah.
and sleeping multiple hours more into the day. So they're missing that natural sunlight. And
Mhm.
you will see this with people that work shift jobs, overnight shift, things like that,
Yeah.
jet lag. But for people with
Yeah.
FASD, sleep-wake cycles can be really all over the map. And part of that is there is some research that shows that prenatal alcohol exposure may adversely impact our melatonin receptors in our brain. So we might have more melatonin
Interesting.
secretion abnormalities, the research has found. And
So
we
we
know how
don't
important,
produce it as much as we should. Is that what you're saying?
yes, it could,
Okay.
or it could just be all over the map. So
Okay.
it's not working at optimal levels.
Gotcha.
And when you study sleep, there's a lot of hormones and neurochemicals involved. Melatonin and cortisol are two very important ones you want to be aware of.
Mm-hmm.
Melatonin should be higher as it gets dark out, and it helps us fall asleep.
Mm-hmm.
Cortisol should be higher in the morning
Okay.
because it helps us be more alert and get going with the day. But
Mm-hmm.
sometimes that can be flipped. And depending on if the person's had a ton of trauma, how much exposure they had in utero
Yeah.
to alcohol, or maybe
Yeah.
there was also drugs and tobacco in utero, or there's
Yeah.
premature birth, or
And you know, we with as in the general population, it's 1.1 to 5%, right? But in foster care or kids who were adopted out of foster care, it's like up to 70% of kids have FASD. But what else do they have if they're in the foster care system? They have abuse and or neglect. So the trauma is pretty much guaranteed to be there, because even just being, even though it's for their good, right? The lesser of evils, just being ripped away from birth family is traumatic in itself, right? And
and
if
you
you have a
named most of it. The one thing, and you
yeah,
said this without saying it, you know it, but it's the attachment disruption too that makes it
mm-hmm,
even worse. And that's part of the talk I'm giving
yeah,
coming up, where there's plenty of research that shows disrupted attachment patterns make sleep worse.
yeah,
Solid attachment patterns are linked with better sleep.
yeah. And every time, you know, if a child has the behavioral issues, which are increased with behavioral issues or with sleep issues, and it's a vicious cycle, because with ramped up behaviors, you know, you get more placement changes, which rip the kid away from they lose attachment after attachment after attachment, eventually not knowing how to form healthy attachments because you
And
can't trust them.
in that too, when they talk about the termination of parental rights or
Mm-hmm.
breakdowns in placement, part of the issue is why sleep is such a problem is because each placement may have different values and
Mm-hmm.
beliefs around bedtime schedules as
Yeah.
well. And depending on the foster care home someone goes into, are they also raising multiple other foster care children
Mm-hmm.
where they're sharing a bedroom and it's
Yeah.
noisy and
Yeah.
all kinds of things to consider. What I'll give you a whole bunch of other things to think about as well.
Yeah. Yeah. That's so huge.
Yeah.
Yeah.
You also asked about sleep apnea and
Mm-hmm.
sleep disorder breathing, and there are some studies in the FASD world that talk about, obviously we know that some people on the spectrum have abnormal facial feature characteristics, and
Mm-hmm.
depending on how severe it is, they might have mid-face anomalies where the structure in their face is actually contributing to disordered breathing. So there's a
Yeah.
structural issue as well
Yeah, because
that could be
there's
at
a
play.
higher risk of cleft palate or cleft lip.
Yeah,
So,
so that's a factor too. We know everyone with FASD has executive function impairments
mhm,
on some level. Sleep issues is basically pouring gasoline on the fire.
mhm,
So if the question comes up, how do we target executive dysfunction in our children or adults who have FASD? Get their sleep under control is one of the best interventions to help.
okay.
It's not going to cure it by any stretch, but it will make it more manageable. And again, sleep issues can drive the bus with anger,
Mhm,
irritability, lack of patience.
mhm,
All of these things need to be taken into account.
yeah,
You talked about this without saying it too, but in the FASD world, if the child or adult is not sleeping, dig deeper. Is there a fear of the dark?
Hmm.
That is very common in this population.
Yeah.
And part of the reason is because the number of kids who are not raised by the birth parents is so high. And depending on
Hmm.
how many placements they've had, that fear of the dark could be a legitimate factor that
Yeah.
drives the bus with their arousal.
Yeah.
So a simple thing is having a nightlight. But
Hmm.
the key is too, that nightlight could be a trigger for sensory issues. So it's very
Yeah.
important to take all of these things out,
Yeah.
just
I
rule
I
it out.
had I had suggested to one of the parents I work with, um, to get a globe for their ceiling light as one that's very opaque and will block most of the light so that it becomes the night light, because they were not able to, they had to literally block off all the room outlets because this kid would stick anything and everything into them. So they put just no access plates over the outlets. And so I haven't circled back to them yet to find out if that was effective, but I'm hoping.
A lot of things we can do, and it can be hit or miss.
Yeah.
So another thing that is talked about too is separation anxiety.
Mhm.
Any kind of anxiety, whatever the cause, you probably don't get the most optimal sleep if you go to bed at night worrying and have a lot of anxiety. So,
Yeah. It's
if,
interesting. You just triggered a thought for me.
yeah,
And I know I'm kind of jumping back to my mom, right? But oftentimes, just like with FASD, she's not able to identify what she's feeling or what emotion she's feeling, or her interoception, the ability to
yeah,
know what's going on inside, is all messed up thanks to Louie. And at times she gets very frightened by this, oftentimes when she's going to bed for the evening. And what I have found actually works better for her than anything else is throwing on the oxygen,
yeah.
putting the cannula on her and letting her have some oxygen for a while seems to help that. And I just thought about that whole connection with anxiety and breathing and sleep. So,
Yeah, deep breathing is a strategy to use,
mhm,
definitely.
yeah,
So,
yeah,
looking
I
the environment,
co-regulate with her with the breathing all
yeah,
the time.
absolutely,
Yeah.
absolutely. Another big factor is environmental stressors. So
Hmm.
again, what's going on in the environment? Is there abuse? Is it inconsistent caregiving practices? Or
Yes.
again, one parent has this belief, the next parent has
Hmm.
another belief.
Yeah.
And one of the worst things we can do to increase sleep issues is have technology in our bedrooms.
Hmm.
I don't like to give any kind of concrete, specific advice, but I'll give you this piece of advice. Get technology out of your kid's bedroom.
Hmm.
If you
Hmm.
allow your kid to have their TV or gadgets in their bedroom, that's
Yeah.
not good. It's
Yeah.
just the research is so clear on that. So
Yeah.
that's a huge factor. The parent-child relationship is another driver for sleep issues. So if it's a parent who's just stressed out, burnt out, comes off as very annoyed, harsh
Hmm.
parenting practices, of course, that makes sleep worse. Parents who
Yeah.
are calm, patient, loving, warm, that supports good childhood
Yeah.
sleep. And then the sensory issue we need to be aware of. And there's actually a really good article that I think was published in 2010. I think it was by Jan and colleagues. Don't quote me on that. In that article, they talk about also being aware of olfactory issues. So perfumes,
Yeah.
soaps, certain
Hmm.
foods, and cigarettes, or to name a
Hmm.
few, can be very, very overwhelming to someone with FASD. Now, on the surface, in the general sleep literature, it may talk about, oh, try incense or a nice
Hmm.
calming candle. Now, for someone with FASD who has olfactory issues, that could be overwhelming
Yeah.
and cause way more sensory issues,
Yeah.
which
I
could
wish there was a
exacerbate sleep.
way, I wish it wasn't accessible to have everyone within foster care or everyone with FASD to have a sensory assessment from, from occupational therapy to just to rule out sensory processing disorder. Um, because you can be hypersensitive or hyposensitive or both, which really
Yeah.
makes it confusing for parents. But yeah, I wish that was an accessible thing. I know where I live, there's only one clinic that has pediatric sensory processing work, and they don't take the county insurance
I
or the
don't.
state insurance. It's private only, and a really long wait list at that, even for those who have the private pay. um, but it really affects so many people, and sensory issues contribute to so many of our struggles.
Just as important, and that is very, very important, a nutritional assessment is so
Mm,
important too,
yeah.
because some of these kids may have more food sensitivities, food allergies, gut health issues can
Hmm.
exacerbate sleep problems. There's so many
Hmm.
things. There's some studies on mold and sleep, not in the FASD world, but if you live in a home that's had a lot of flooding or it's really
Yeah.
old and mold can exacerbate it.
Yeah. Yeah.
Undiagnosed learning disabilities have been linked with more sleep problems.
Really?
Yep.
So is that the memory factor again?
For some kids, they may have a hard time learning the strategies to calm. Some kids with learning disabilities may get teased more and bullied more and have more shame, self-esteem, depression.
And
These are
those
just some,
thoughts ruminate and interfere with
you know,
rest. Yeah.
connecting the dots, using
Hmm.
time effectively, abstract reasoning deficits, and all of these things definitely kind of link together and stuff.
Hmm.
But
Hmm.
I know we're running up against the clock.
We are.
I'll run through a couple more things in this literature, just so you're aware of
Okay.
that in the FASD world, the most common sleep disturbances are talked about as irregular sleep patterns, sleep anxiety and sleep fear.
Hmm.
Night terrors have been noted to be more common.
Yeah.
Having difficulty falling and staying asleep, increases in sleepwalking, and
Hmm.
parasomnias, which are basically unusual behaviors as someone's falling asleep or while they're sleeping or right when they're waking up.
Hmm.
Like parasomnias could be like nighttime eating, sleepwalking, just bizarre behaviors. Sometimes it could be very dangerous behaviors too.
Hmm. Hmm.
And then the melatonin secretion kinds of issues that we talked about as well. So those are a few things you'd want to consider. Rule out any medical issues. If
Hmm.
that child or teenager or adult with FASD has any medical issues going on, could be asthma,
Yeah.
allergies, acid reflux, chronic headaches, anything that causes them distress in their body
Hmm.
can absolutely interfere with sleep as
Yeah.
well. So
Yeah. Yeah, for
that's
sure.
kind of, that would be, I think, the tough stuff in a nutshell. Is there
Okay.
anything you want me to go a little bit deeper into with any of those things or?
No, I think we'll just break here and then come back for the second episode. So to all my viewers and listeners, like I said, this is a two-part topic. So I don't know yet if I'm going to put them both out on the same day or just paste them, one day after the next, but please tune back in for part two, where we're going to talk about some of the interventions. So if you're recognizing any of these causes or effects in your life or in your child's life or your loved one's life, then in the next episode, we'll be discussing strategies you can use to hopefully get the sleep issues buttoned up and start sleeping better and experiencing restorative sleep. Because I know I have found sleep and rest are not necessarily the same thing. And if we can get them both at the same time, that's optimal. So again, come back for the next episode, same week, of living with FASD, and we will finish up with sleep interventions and strategies. Thanks so much for tuning in.